Episode 550. Rosep View, Chile, historically has a wood-burning pollution problem. See 3 journal articles, from 2021, 2018, and 2017, below. Chile, the cities of Molina and Valdivia, 2021. Wood-burning pollution in Chile, a tale of 2 mid-sized cities. Science Direct. https://www.sciencedirect.com, Science article, Pi. 2021, cited by 2 mid-sized cities in southern Chile, Molina and Valdivia, have been suffering high levels of ambient PM 2.5 because of residential wood burning for years. This abstract. Cities in southern Chile are facing high levels of PM 2.5 because of wood-burning pollution. We quantify the contribution of wood smoke to fine particles in 2 mid-sized cities, Molina and Valdivia, located in different climate zones. The sampling campaigns were carried out during austral winter, July to September, in 2018, Molina, and 2019, Valdivia. Average winter concentrations of PM 2.5 were 53 micrograms per meter cubed in Molina and 89 in Valdivia. The major component was 70% PM 2.5, particulates of 2.5 micrometer size. The major source of PM 2.5 was wood smoke, which accounted for 41% in Molina and 43% in Valdivia. Secondary organic aerosols, SOAs, generated from inefficient wood burning, contributed 20% in Molina and 29% in Valdivia. Secondary inorganic ions and dust are minor sources of PM 2.5. The total contribution of wood smoke, adding primary wood smoke and SOA, could be as much as 83% in Molina and 81% in Valdivia during the winter season. Chile, smothered by wood-burning cook stoves and heaters, 2018. Rosep View, the primary, PM 2.5 pollution, culprit in Coyhaique is simple, wood heating. In Santiago, 200,000 wood-burning stoves were replaced with cleaner-burning paraffin or wood pellet heaters. In Coyhaique, a few residences upgrade from wet wood to a combination of wood pellet, paraffin, and gas. Rosep's view is that these half measures are a poor substitute for the real solution, ending residential wood burning across Chile. In Chile, bounded by mountains and smothered by wood. Pulitzer Center. https://pulitzercenter.org, Stories, Chile bounded MO. December 10, 2018, much of that indoor particulate pollution, including in Chile, can be tied directly to wood-burning cook stoves and heaters. In Chile, bounded by mountains and smothered by wood smoke. Project. Breathtaking, gasping for air across the globe. Excerpt, edited by Rosep, for brevity and clarity. A 10-year-old girl has severe asthma, and most trips outside her home in the town of Coyhaique involve wearing a mask or even a respirator. Natalie had her first asthma episode when she was 4 years old. Now 10, she wears a mask at all times outdoors and must inhale steroids twice a day to control asthma attacks. Natalie's mother is among the small but growing number of local residents who have transitioned away from wood. Pilot projects are exploring other ways to bring alternative heating and cooking fuels to the wood-dependent community of Coyhaique. Coyhaique, Chile. On a midwinter Saturday, a 22-year-old mother of 2 sat in the waiting room of the public hospital in Coyhaique. Her 2-month-old son had a respiratory infection that kept him in intensive care for a week. All of this must be because of pollution, the child's mother lamented. Coyhaique, a city of 60,000 people in southern Chile, was promoted as a pristine natural reserve, but today the air in Coyhaique is considered to be the most polluted in South America. On certain days, and at some specific hours, it can be among the most polluted cities in the world. A study at the University of Santiago, USAC, in May of 2016 established that Coyhaique sees hourly concentrations of PM 2.5, particulates in the air of 2.5 micrometer size, higher than Beijing, although the Chinese capital has higher annual concentrations. The impacts are real, and nobody expected this from tranquil Coyhaique. Officials had thought of using Coyhaique as a control city to show how this supposedly clean Patagonian city compared to cities like Santiago. As it stands, Coyhaique sees annual average PM2.5 concentrations of about 64 micrograms per cubic meter, well above global standards, considered safe. At certain times of the year, levels can double, or even triple. The primary culprit in Coyhaique is simple: wood heating. 1,200 miles from the Antarctic, temperatures in the region can drop below 0 degrees Fahrenheit during the winter, and wood, plentiful and less expensive than other options, is used in 96% of the homes. Most homes and businesses in Coyhaique are heated with wood in stoves that cause high levels of PM2.5, both indoors and outdoors. Efforts to curb wood use have run up against both economic and cultural resistance, but the public health impacts are real. The pollution is inescapable, swirling in clouds, hanging heavy over the valley, and hovering in the air indoors. Exposure to household air pollution was responsible for as many as 2.6 million deaths worldwide in 2016. Much of that indoor particulate pollution, including in Chile, can be tied directly to wood-burning cook stoves and heaters. The most serious problem here is pollution and how that affects public health. Last year, we had several dozen children transferred to hospitals in other Chilean regions, mostly due to bronchopulmonary and respiratory diseases. A politician's own child was among them. I worked hard to get a plane ambulance to be able to transfer kids, because some of them died and several ended up with long-term physical damage. In their most recent State of Global Air Analysis, the Institute for Health Metrics and Evaluation at the University of Washington in Seattle and the research nonprofit Health Effects Institute in Boston estimated that household air pollution was responsible for 2.6 million deaths worldwide in 2016, the eighth highest risk factor for early death globally. The United Nations (UN) Environment Program estimates that air pollution costs the Chilean health sector at least $670 million annually, with 127,000 visits to emergency rooms and clinics, and 4,000 premature deaths annually. In 2017, a wood stove pollution outbreak sent hundreds of children to regional hospitals. "We have many children with long-lasting damage from Coyhaique's pollution," said a pediatrician at Coyhaique Regional Hospital. Several mothers in Coyhaique organized public demonstrations to raise awareness and to force politicians to take action. Natalie, daughter of one of the demonstrating mothers, had her first asthma episode when she was 4 years old. Now 10, she wears a mask at all times outdoors and inhales steroids twice a day to control asthma attacks. Natalie's mother is among the small, but growing number of local residents who have transitioned away from wood. The home's heating and cooking systems were upgraded from wet wood to a combination of wood pellet, paraffin, and gas. Natalie's family enrolled in a pioneer governmental test program that provides them with an indoor pollution monitor. Such reform is slow but ongoing. Pilot projects are exploring other ways to bring alternative heating and cooking fuels to the wood-dependent community. UNDARC measured PM2.5 levels at more than 300 micrograms per cubic meter of air inside some residents' homes, multiple times beyond what public health experts consider safe. Santiago, Chile. In the north, Santiago has long battled its own air pollution problems. In the capital city, home to 5.6 million people, 2 decades ago, air pollution was endemic. The federal government launched an ambitious program to replace 200,000 wood-burning stoves with cleaner-burning paraffin or wood pellet heaters. The move has helped nudge emissions of particulate matter down in many urban areas. The Chilean Ministry of the Environment reported a reduction in severe air pollution episodes in major cities of the center-south Chile region by 45% from 2016 to 2017.